Hello, scholars. My name is Dr. Karis Dillon, and the goal of this channel is to make academic subjects easier to understand. In the last video, we talked about schizophreniform disorder, and in this video, we're going to discuss schizophrenia. So let's get started. In order to be diagnosed with schizophrenia, the individual has to have two or more of the following symptoms, with both symptoms being present for at least 30 days. This is different from psychotic disorder as well as schizophreniform disorder. Now, at least one of the two symptoms has to be delusions, hallucinations, or disorganized speech. Now remember that delusions are fixed ideas or beliefs, false beliefs that conflict with reality. So even if the person is given evidence that this is not the case, that their beliefs are not true, they don't in any way believe that. So that is a delusion. Hallucinations are sensory perceptions that are not seen, heard, or sensed by others and are not present. And then disorganized speech is rambling or incoherent speech that makes it difficult, if not impossible, for another person to understand. The other two symptoms that can arise with schizophrenia are catatonic behavior, which is an individual that's in a stupor where they're staring off and aren't moving from that. They may have rigid body poses or structure. And then number 5 is negative symptoms. This means that the person does not seem to have a lot of emotional expression, or they could have avolition, which means a lack of motivation towards doing things. So along with these symptoms, you're going to see the individual have a large change in one of the major areas, like their work, like their studies, within their relationships with others, or within their self-care. This change has to be different in one of the areas as compared to when the symptoms came about. So they're seeing a difference in the work or in the self-care or in the relationships as compared to before the symptoms. If the individual has the symptoms come about when they are a teenager, you may see that decrease in self-care or within their academic studies. Now, these symptoms have to be present for at least 6 months, and this is different from schizophreniform disorder, which is 1 month all the way to 6 months. If it goes longer than that, that's where we move into the diagnosis of schizophrenia. The individual has to have one of the 5 symptoms listed above that we just talked about, and it's got to be in an active stage for at least a month, or at the beginning of the disease or in its continuation. So it's really important to rule out schizoaffective disorder as well as bipolar disorder with psychosis. It's also important to make sure that the individual has not been put on any medication or taken an illegal substance that could create psychosis. You also want to look at any medical condition that could bring about psychotic episodes. So when a person is diagnosed with schizophrenia, their symptoms may include emotional issues, behavioral abnormalities or problems, as well as cognitive problems. Cognitive means thinking through things. They will have trouble with their jobs or studies, as well as within their relationship. So it's really devastating to many different components. Those that are diagnosed with schizophrenia will not have symptoms that greatly mirror others with schizophrenia, and that's kind of the tough part about diagnosing. There's really no blood test, there's no urine test or putting them in an MRI. We just don't have something to state profoundly that, yes, this individual has schizophrenia. So because they're so different from somebody else with schizophrenia, that makes the diagnosis even harder. Symptoms can definitely differ from individual to individual. If an individual is diagnosed in adolescence with schizophrenia, it's really important to take a look at their siblings so you can kind of get a baseline for behavior. Generally, those with schizophrenia do not have one dominant symptom, but will have many that are present and there at different times. Remember that avolition, which means that lack of motivation, really will impact their social relationships. Having issues with one's mood during episodes can happen as well. And that tends to happen more with the active phases of schizophrenia. Those with schizophrenia may have emotions that are not typically displayed in certain social situations. During sad moments, they may laugh, or they may just seem apathetic. During an active phase, their mood may shift to display anger, depression. They may not want to eat. They may have their days and nights mixed around. Individuals may feel like they aren't in their body, or they're having delusions about their body, but the evidence shows that this is not the case. So it's not uncommon for someone with schizophrenia to feel lots of anxiety about lots of different things. Some individuals with schizophrenia may not be aware that they have the disorder. They may not be aware that they even have symptoms. The more that an individual with schizophrenia is unaware of their disorder, the more risk factors they have for treatment not working with them or them not being compliant with treatment. Individuals with schizophrenia can also be aggressive. Now, yes, this is the case, but I want to make sure that you understand that individuals with schizophrenia, on average, are less aggressive and less hostile than the average population. So if you put a group of individuals that did not have schizophrenia and another group that had schizophrenia, the individuals with schizophrenia are less likely than the average population to have aggressiveness and hostility. Now, every once in a while, we have a situation where an individual is hostile or aggressive, and that can happen. That tends to happen more with males than with females. Unfortunately, the media and television tend to stereotype individuals with schizophrenia as being aggressive or violent, which is just not true given the averages. So there are no tests currently that diagnose this disorder. We do know that there are imaging differences or neuroimaging differences with white matter as compared to gray matter with those that have schizophrenia. Radiologists have also noted that brain volume of individuals with schizophrenia tends to reduce over time more quickly than individuals without the disorder. So the prevalence of schizophrenia in the population is 0.3 to 0.7% of the population. So these statistics vary depending upon the race of the individual. And I know that we've talked about this before, but men are diagnosed with schizophrenia more often than women are. The disorder tends to appear usually in the late teenage years to the mid-30s. And most individuals diagnosed with schizophrenia notice symptoms that appear over a period of time. Symptoms can come on very quickly, but that tends to be the exception more than the rule. Half of the people that are diagnosed with schizophrenia also have depressive symptoms. Scientists have noted that males tend to have a worse long-term outcome as compared to females. And any issue that the individual has with cognition doesn't seem to change whether they're in an active stage versus a stage of remission. So in about 20% of individuals that are diagnosed with schizophrenia, these individuals have a good outcome with medication and will recover from the disorder completely. A majority of those have to stay on their medication. There are a few that do not. Most individuals that are diagnosed with schizophrenia will need assistance on a daily basis, though. They'll go back and forth between having active symptoms and phases of remission. Some individuals with schizophrenia will get worse and worse over time, no matter the treatment tried upon them. Heredity plays a large role in schizophrenia. Many individuals that have been diagnosed have a relative with the disorder. So other issues that could come up that could put a person at a higher risk are complications during pregnancy, birth, or having an older father can put people at risk. 20% of individuals diagnosed with schizophrenia will attempt suicide. 5 to 6% will die by suicide. Individuals that suffer from hallucinations may have visions or voices that command them to take their own life. It is very difficult for an individual with active phases of schizophrenia to work a job or go to school. Abolition tends to remain high with these individuals, and cognitive issues can create problems when relating to other persons. Half of individuals with schizophrenia have tobacco use disorder and tend to smoke on a regular basis. Anxiety is also high with individuals with schizophrenia. Comorbidities, given panic disorder and OCD, are also at a higher rate. Sometimes medical conditions such as metabolic syndrome, cardiovascular disease, and weight management can be observed. All right, well, that is the end of the video. I hope that this has helped to better understand schizophrenia. If you like the video, please give the video a like and don't forget to subscribe. I thank all of you very much for being here, and I really appreciate it. Have a wonderful day.